National Nutrition Natural Health Reviews. 3 minutes of the latest naturopathic info with Canada's leading nutrition experts. Watch, learn, and get healthy naturally.
Hey there, Dr. Jonathan Beatty, naturopathic doctor and a health expert here at Nationalnutrition.ca. I want to tell you a little bit about bronchitis today. It's something my patients ask me about all the time. It's sometimes characterized as asthma. You can sometimes experience it as recurrent infections of the upper respiratory tract. But first and foremost, what the heck is a bronchus? So the bronchus is essentially the tube that runs from your mouth to your lungs. That's the easiest way to think about it. It then breaks down into smaller tubes we call bronchioles, and then into little tiny pockets, kind of looking like little grapes or little empty sacs that look like a bunch of grapes, which are called alveoli. And that's where the exchange of oxygen happens between the outside world and your blood. So the bronchus is essentially the tube that fills your lungs. And so if you have any type of inflammation of that tube, of course, what comes with inflammation? Swelling. So the big tube gets narrower, it's tougher to move oxygen through that tube, and of course that's going to cause shortness of breath. It can cause chronic coughing, excessive mucus production, which if it builds up in the lungs can lead to the development of pneumonia. So it's really important that we get bronchitis treated. Now, bronchitis, essentially it just means inflammation of the bronchus. So ultimately, not a very specific diagnosis. In fact, it's not a diagnosis at all, it's just a symptom. Okay, you can have what we call viral bronchitis. So a virus is causing an infection leading to that inflammation. It can be bacterial, again, a bacterial infection causing the problem. It can be due to allergies. So if you have an allergy, an exposure to a certain protein in the air called an antigen can cause your immune system to overreact and create inflammation of the bronchus. Any which way you have it though, you end up with bronchitis. Thing is, cause is important because depending upon the cause, that's going to of course determine the various treatments. If it's allergic bronchitis, so if you have an allergic reaction that leads to the development of bronchitis, typically you'll find that your bronchitis is seasonal. You know, either it's concentrated in the spring, it's concentrated in the fall, sometimes it's at both times of season. That's often related to an allergic bronchitis when certain pollens are highest, and that's more likely to induce the bronchitis. If that's the case, try and avoid going outside between 5 a.m. and 10 a.m. when the pollen levels are highest. Or, you'll probably notice you're less likely to develop bronchitis if you go out after a rainstorm. Again, the rain helps suppress the pollen in the air, and you might find a much easier time breathing just by simply avoiding exposure to excessive amounts of pollen. If it's another type of allergy, I've seen a lot of cases. I actually personally grew up with asthma, which is characterized by, it's essentially a type of chronic bronchitis, and mine was actually induced by an allergy to cow's milk. So again, sometimes identifying food sensitivities can be a very great way to avoid having any type of bronchitis by, again, removing the cause of the problem in the first place. If it's a viral infection, of course, treating your immune system, ensuring that your immune system is optimized to kill the virus is going to be the best way to treat the bronchitis. And if it's bacterial, again, identifying the bacteria causing the problem and then figuring out what the best antibiotic treatment is for that, very effective way. You can go to your doctor. Actually, it's not necessarily the most exciting or pleasant treatment, but you expectorate or cough up some of the phlegm, and your doctor can actually do what's called a culture and sensitivity, see what type of bacteria is growing, and figure out what the most appropriate antibiotic is to treat, and then use that. If you like to go the more natural way, there's a variety of herbs that you can use. If it's a bacterial infection, look for your more antibiotic herbs. Things like garlic is a great antibiotic for bronchitis. Golden seal is one of my personal favorites. Very strong antibiotic compounds found in the golden seal root. Very effective for the treatment of bacterial bronchitis. If it's viral, you got to tweak your viral immune system. Very important to have adequate vitamin D, which helps run your viral immunity. It's also very important. One of the other things I recommend is lemon balm. Lemon balm helps stimulate our body's immunity against viruses. And lastly, something called elderberry or Sambucus nigra. And it's very effective at, again, preventing what we call viral replication. So what the Sambucus nigra does, or what the elderberry does, is it actually reduces the virus's ability to replicate itself. You weaken it by just decreasing its numbers. That makes it easier for your immune system to clear the virus and reduces the duration and severity of your bronchitis. Now, obviously with bronchitis you get symptoms. You can get a sore throat, you can have a chronic cough, lots of sneezing, lots of mucus production. All of that comes from the root, the itis, the inflammation, okay? It's the inflammation of that bronchus. So using some herbs to help manage the inflammation can be very effective. I often recommend something called slippery elm, or Ulmus fulva is the Latin name of this herb. If you use the inner elm or the inner bark of the slippery elm tree, it's a very good what we call demulcent. It basically just reduces the inflammation of mucous membranes. I also like using mullein, or its Latin name is Verbascum thapsus. This herb is very effective at, again, reducing inflammation. It helps manage coughs. So these two herbs can be added in addition to your antibiotic or antiviral herbs to then just manage the symptoms. And lastly, weirdly, a spoonful of honey. The sweetness actually helps to suppress the cough reflex. And there's certain antibiotic and antiviral enzymes found in unpasteurized honey that can actually help your body to treat that infection. So that's one other way that you can help to manage chronic bronchitis. So if you do suffer from it, consider some of the therapies I ran down today. Again, it is important to get a good diagnosis as to what kind it is, allergic, viral, or bacterial, as to what's creating the bronchitis, so you can treat it with the most effective therapies. So I hope you've learned something very helpful today. Check out more of our natural health videos, subscribe. Any questions or comments, please post them below. And always remember, knowledge is health.